So yeah, just to introduce myself again, I'm the head of public health promotion and community engagement for Oxfam's global humanitarian team. And I'm also an HCRI alumna as well. So welcome to anyone who is studying with HCRI who's on the call today. So I'm just to give a little bit more details about kind of what I do for my role. So I'm an advisor within our global humanitarian team. So what that team does within Oxfam is it's part of a surge and advisory team that comprises of staff from all around the world with different technical competencies in things like water, sanitation, hygiene promotion, food security, cash protection, gender, monitoring, evaluation, program management, all of the kind of technical skill sets that you would expect to see responding to large scale emergencies. So our team is roughly about 120 people, and they are the humanitarian expertise within Oxfam. So the team that we have is deployable to large and medium scale emergencies to work with our country teams to give them that extra support when there are emergencies happening. So some of the current large-scale responses that we are currently working on include Gaza and Lebanon, where we've been working for over the past year. We've been working also as well in response to Sudanese refugees entering into CAR and also entering into South Sudan, and responding to multiple cholera outbreaks around the world, including in DRC, Malawi, Zimbabwe, Yemen, and we've just heard as well that there has been a new cholera outbreak also in South Sudan. The team also works on supporting fragile states or states that have kind of multiple emergencies happening at the same time. So, for example, somewhere like Syria that still has conflict ongoing, but also now has Lebanese refugees entering into Syria. Places like Yemen, where there has been, conflict for a long time, but now also cholera, Somalia, Burkina Faso, etc. So lots of different contexts that we work in across the world. And Oxfam is quite unique in the way that it structures its water and sanitation and hygiene programming. So it recognizes that the engineering part of water, sanitation, hygiene provision is a distinct skill. And then the public health aspect is also a distinct skill in itself, and it's not easily done by each other. So what we have is two teams. We have an engineering team and we have my team, which is the public health team. And together we are our water and sanitation and hygiene team. So I'm kind of leading one half that is more focused on engaging with communities and looking at epidemic preparedness and response. So the main elements really that I cover in my role is quite diverse, but the key kind of three areas are working with communities in terms of analysing and looking at different solutions to public health risks. And that includes working with our engineering team in terms of making sure that we have the right water, sanitation and hygiene infrastructure in place. And in emergencies, that can kind of range from, ensuring the basics are there, but also kind of up to large scale infrastructure and making sure that people are engaged in how those are created. The second part of my role is really working with communities, health actors and others in terms of epidemic preparedness and response, particularly wash-related diseases such as things like cholera, scabies, diarrheal disease, but also for other outbreaks of epidemic potential. So things like Ebola, COVID-19, and then very recently Mpox. And then the last kind of key part of my role is working with communities more broadly during responsives to ensure that there's an inclusive approach. So that is often looking at elements of human health that get a little bit forgotten. So things like menstrual health and hygiene, incontinence, disability, older age, etc. So trying to kind of bring in those different aspects into our programming. On a day-to-day basis, the kind of things I do is really kind of making sure that the strategic vision that we have for public health programming within Oxfam is being implemented in our country programs, and that our countries have the support that they need to be able to do that. So that can be things like offering advice or supporting on proposals, creating preparedness plans or strengthening capacities with countries. I also represent Oxfam externally, particularly at global level fora, so contributing into things like global level guidance or recommendation on different strategies on public health or different response options. And I also manage individual projects. So that could be working with country programs or kind of working on a project at the global level. So, for example, at the moment, I'm working on a project with HelpAge and a Malawian organization called MANEPO, looking at the needs of people with incontinence in humanitarian contexts. And then because we are a surge team, very often I'm asked to step into cover roles during emergencies, either within public health or sometimes that can be part of leading a response overall. So recently I've done that in Turkey after the earthquake there, and in Gaza earlier this year. So what I thought would be helpful maybe just for the next few minutes, I know there were a couple of questions that were shared or a couple of things that people wanted to hear from each of the speakers. And I thought I would just kind of highlight a couple of key things along my career route that might help to kind of answer some of those questions that people had. So the first one, if I just, move the slide on there, is to say that I didn't start out working in humanitarianism and working in public health. I actually started at Manchester Business School, which you'll probably all be familiar with. And ironically, as a career advisor who didn't know what to do as a career. But I wanted to mention this because it's really around the idea of transferable skills. So whilst I was working at MBS, one of the things that I had as part of my role was a lot of project management. And really kind of what I do day to day in my work now is a lot of project and people management. So I really wanted to highlight the fact that kind of moving into a career within public health, particularly within the humanitarian sector, think about kind of the transferable skills that you have and how they might apply, and really try to emphasize those when you're applying for roles as well. I also wanted to mention here a little bit about why I wanted to do the role that I'm in now, and kind of where that kind of drive has come from. So when I was a teenager, I worked quite a lot with Girl Guiding, and I got to travel quite a lot internationally with them. And I went on a trip to Bangladesh. And in Bangladesh, that really kind of opened my eyes up to kind of different ways of life, different people, and also different challenges that people around the world face. And I knew that I wanted to have a job that had meaning to me, something that really challenged me, but also that involved travel and meeting new people and working in different ways. And I really kind of initially started looking at jobs and education in development. But it was really when I first went to the overview of the HCRI lectures that the penny really dropped for me. And I thought, this is it. This is what I want to do. Humanitarianism is the thing that I want to be part of. So then the kind of the first step for me, well, before kind of I worked at Redar UK, which is a training organization. I should really say that kind of the first step for me was really starting my career again. So I kind of went from a very nice job at MBS with a good salary to really kind of doing an unpaid internship with ActionAid. And there I was like literally photocopying. So it was a little bit, the first step is kind of anything really to get an NGO name on the CV is always very helpful. But also while I was there, was very, very honest with my manager about what I wanted to do in the longer term. And she was very helpful in terms of kind of allowing me to volunteer with other teams within ActionAid and really kind of getting to understand how NGOs work. So it's not necessarily what people want to hear, to say that, you know, sometimes a good first step is an internship, but quite often it's a very helpful first step to get into kind of humanitarian work. I wanted to highlight Redar UK because I think it was working with Redar where I got to meet people who had been experienced in the sector for a very long time. But it also gave me a brilliant opportunity to network. And again, this is something that I would really highlight as being key for kind of careers within humanitarianism. I think kind of if you're clear with where you want to go to, people are very happy to support and help and connect you with other people. But kind of using that network and kind of demonstrating to others the skills that you have, I think is one really good way to keep forwarding on the career. So after Redar, I moved on to work with IMC, and this was really where my interest in kind of working within public health had started. So before I worked with IMC, I had my master's from HCRI, but I didn't have any specific qualifications in public health. So here at IMC, it's a medical organization, a US organization, and I was working very closely with the medical team. So that kind of started or kind of renewed an interest that I'd had since being younger. My mum is a microbiologist, and quite often, if she couldn't afford a babysitter, we'd go into work with her, and she'd set us up with a microscope and blood films with things like malaria and sickle cell, and then give us the books so we could look up the details. And I think my fascination with public health has kind of come from that. But really kind of whilst I was working with IMC was where I did my public health masters with London School. But also this was my first time kind of working with an NGO in a humanitarian response. And it was really such a steep learning curve. And the people that I learned the most from were my teammates. And you can see quite a few of these in the pictures here. So it's another kind of piece of advice in terms of kind of careers in these sectors is really about kind of retaining that sense of learning, that curiosity and wanting to learn from other people. And I think that has been really important for me in terms of kind of moving my career ahead. And then just some pictures here from my time with Oxfam, and I've been with Oxfam for just over 10 years now. But again, kind of career advice wise, it was really around just kind of jumping in at the deep end and learning to swim. So my first deployment with Oxfam was to the 2014 Ebola pandemic in Sierra Leone. And I hadn't at that point finished my public health masters. So there was a lot of learning on the job, and there was a lot of things that I really wasn't prepared for. So it's just to highlight that particularly within the humanitarian sector, it does take a certain kind of outlook to feel comfortable in that kind of context where the goalposts change every day. Sometimes they change every hour. So to really be honest with yourself as well and say if humanitarian is not for you, that is absolutely okay. You know, there's also development work where things are a little bit more stable. And there are also elements of humanitarian work as well that are perhaps not as chaotic as first phase response. So have a think about kind of where your comfort zone fits as well. And I think this is kind of really one of the main things that I really love about my job is that I kind of don't know what will happen tomorrow. I mean, I have my calendar and I have my meetings set, but who knows what will happen in the world. So you never know kind of what tomorrow might bring. And particularly where that's a public health issue, I really enjoy the aspect of it being a bit like a puzzle. and bringing kind of all the different pieces together to try to understand it, to help others, particularly kind of people, our teammates working in country programs, bringing them together to see that picture and the parts that they need to play in kind of resolving any of the problems. And it's honestly something that really still gives me a buzz, kind of, you know, still 15 years on of working in this field. So hopefully I've covered there some of the different questions that people had raised, and I want to stop there to allow for questions as well, because unfortunately I can't stay for the full meeting today. But I'll stop there, and if there are any questions that people would like to ask, please do.
Thank you, Michelle. Fascinating presentation. Thank you so much. We've got a question here from Jack Kingsley. Can you expand on the surge aspect of your job? How long are the deployments in country, and do you fall into an incident management system akin to emergency services, fire, FEMA, or are you operating in a cluster system?
Yeah, so when I first started working with Oxfam as what we call a humanitarian support personnel, there the deployments could be anything from, I think my shortest one was 2 weeks and my longest one was 18 months. And everything kind of in between. It was kind of, you know, 3 to 6 months was about the average, sometimes longer. Now that my role has changed slightly and I'm an advisor, tend to go for a maximum of 3 to 4 weeks. Usually it's around 2 weeks for different country visits or for kind of surge support until we have more staff coming in. In terms of kind of how the management works, it's a little bit of an interesting one for Oxfam because we're a confederation, so each country program manages themselves. So it depends a little bit on the structure in the country program when you get there. However, we do tend to have kind of pre-made organograms or pre-suggested organograms in terms of a large response in particular to have a response manager, technical leads, team leaders, etc. So you kind of already know the different roles that you're going into when you get called up for a response.
Lovely. So this is from Sophie Dearden. I'm a postgraduate student looking for my first humanitarian job next year. You mentioned internships. Is there any other advice you could give about getting your foot in the door? I've completed a lot of intern voluntary experience, so now I'm looking for my first graduate role.
Yeah, so I know internships are kind of one of the key ways that people kind of get their start in different NGOs. The other advice, I mean, this didn't, I didn't follow this route, but the other advice that was given to me also at the time when I was looking was, as kind of morbid as it sounds, is to kind of wait for a big emergency and to send your CV with your relevant qualifications to different NGOs proactively at that point, because at that point it's more likely that agencies are scaling up, so they want to kind of have a broad range of people to draw on, and that can be a good opportunity to kind of get your name known or at least kind of get some different contacts. The other aspect I would say is maybe around kind of a bit of a sidestep. So I know a lot of people who work now in the team with me, they might have started doing something in funding or in project management or in administration. And then because their skill set is obvious and because, you know, lots of agencies like to develop their own people, then they have moved into roles and response roles kind of from there because they've kind of demonstrated that they have the right skill sets in doing some of the different roles. So that's always another thing, is to think about, is there a role that you could work in that is maybe based in your home country and then kind of sidestep more into a response style role?
Lovely, thank you. So there's a question from Gallant Baggish, who's a BSc student. Thanks for the talk. Which NGO would you recommend getting in contact with to set up a postgraduate internship? I'm really interested in getting involved in your field. So I'm interested in that as well. What are the opportunities for someone who's done an undergraduate degree?
Yeah, I would say it really depends on kind of what you want to focus on. So I know that everyone kind of on the call today is mainly looking at kind of public health or health related aspects. And there are NGOs that are specific to kind of either medical or public health aspects. So I'd say kind of do a little bit of research about which NGOs kind of have technical areas that align with what you would like to work in. So for me, for example, I knew that I was really interested in water sanitation and hygiene, public health, and I knew that was something that Oxfam wanted to do. So they were kind of in my uh, like sight of where I wanted to get to eventually. So maybe kind of have a look at some different NGOs. I mean, certainly within health and within public health, MSF is obviously the very big name, and that we have Ahmed who will be speaking later. But also IMC. There's also small, like, well, not necessarily smaller, but perhaps less well-known organizations, people like FHI 360, Mentor Initiative, who focus very much on vector-borne diseases. So there are kind of NGOs with different specialisms. So I try and look for something that aligns with your interest and then pursue from there.
Lovely, thank you. So this is a question from Alec. In terms of getting started in the sector, do you think it's better to begin by applying to smaller NGOs, you've kind of already covered this, as opposed to the larger conglomerates? And how has the job market changed since you began working in the sector? I'm loving these questions.
Yeah, that's a really, really good question. Um, yeah, definitely. I think it's so competitive within the kind of NGO sector, and particularly competitive for kind of humanitarian style posts, I think. And I've definitely seen that become a lot more so in the kind of 15 years that I've been within the sector. I think as well, what I've seen is that there is much more desire for kind of professionalism as well. So whereas maybe sometimes it was easier kind of 15 years ago for me to just kind of, do some networking and maybe someone say, oh, okay, give this a go. I think we see kind of less and less of that happening now, and it's much more kind of professionalized,
Mm.
which is really challenging because it's hard to get you need the experience to apply, but it's hard to get the experience in the first place. So you get stuck in this catch 22.
Mm.
So definitely, I think smaller organizations are certainly worth applying to. There's loads of fantastic small organizations that are doing incredible work. And if you can kind of work within those smaller organizations, you can work in the larger organizations. It's just a question of scale. So having that experience wherever kind of you get it from is always a bonus.
And we have a question from Janice, who's a BSc student. I have an opportunity to be promoted to the inclusion coordinator at the youth zone where I work at. Do you think if I accepted this post, it would help me pursue a public health career?
Yeah, I mean, absolutely. It kind of goes back to what I was saying about the transferable skills. So I guess within Oxfam, it's maybe slightly different how we work because I'm covering public health, but also elements associated with kind of broader WASH programming as well. And that's really where the inclusivity elements of my role come in. However, one of the things that, and I'm sure you're kind of covering this in your studies as well, but for all humanitarians, we're working towards kind of a shared humanitarian standard. And a lot of that is around inclusivity, understanding communities that we work with, and having that skill set of really kind of empathy and community kind of driven responses. So anything that you can do that kind of demonstrates you have that awareness and that understanding, I think is certainly valuable.
Brilliant. So a question from, I'm not sure if I'm pronouncing your name correctly, Oz. I am a physician from Jordan doing my MSc in Global Healthcare Management at Coventry University. I have a great interest. Sorry. have a great interest towards starting my career in global health and humanitarian aid organisations. Any tips, knowing that I am a native Arabic speaker and at a proficient level in English?
I mean, I think you have a very kind of good opportunity. It's horrible to say it that way, but because of a lot of the things that are happening in the Middle East region and in Arabic speaking countries at the moment, there is always a big demand for languages. So any languages that kind of relate to the countries where a response is happening, and Arabic, of course, is extremely useful because there are many countries that use Arabic. And particularly, I think, the Middle East with conflicts and responses as they are, but also in the future with things like climate change, there's only going to be more demand that's coming up for Arabic speakers. So absolutely, I think it's a real asset. And I would kind of do a little bit of research about who is responding in the type of work that you would like to do, and maybe make that approach to them to just kind of offer your background and highlight your skills to them.
Wonderful. And just very quickly, this is from Salim. Could you ask Michelle for me about, does having a master's degree mean more and better career opportunities in the humanitarian and development field? And obviously that's very relevant for our BSc students as well.
Yeah, absolutely. I mean, so this is one thing that I don't think has changed in the 15 years that I've been doing this work. Is when I was first applying, I didn't have a relevant degree. I didn't have a relevant master's degree. And one of the pieces of feedback that I got from Minds Action Group, MAG, was that everyone who'd got through to interview stage had a relevant master's degree. So I think it is really kind of expected now, and it's kind of aligned with what we were saying before about that professionalization. I think the expectation is now that you would have a master's degree in a related topic. It doesn't necessarily have to be a specific humanitarian master's degree, but I think certainly for public health, global health, I think the expectation is there that you would have a master's level degree.
Wonderful. Thank you so much, Michelle. We'll leave it there. Thanks for the brilliant questions and the really useful answers and a really fascinating presentation. Thank you so much.